Throughout the pandemic, medical science has informed how we stay safe, but social science plays an equally vital role, especially in planning for our recovery. Here to explain more is Dr. Carolyn Smith Morris, a medical anthropologist and professor at SMU, and Dr. Do-Young Kim, professor and associate dean for graduate education in the School of Economic, Political, and Policy Sciences at UT Dallas. Glad you could join us. Dr. Smith Morris, medical anthropologists play an important role during global health emergencies. For those that are not familiar with what the work of a medical anthropologist is, tell us what you do.
I was trained at the University of Arizona in archaeology, linguistic anthropology, cultural anthropology, and biological anthropology. And so what makes anthropologists distinctive and what medical anthropologists bring to public health crises and global health concerns is that interdisciplinarity. We're broadly trained so that we know where to find specialists and when to bring them in. So we do a lot of team-based work. And I've certainly done that in my career with indigenous and marginalized communities struggling with chronic disease.
Dr. Kim, what is social science and how does it differ from or intersect with medical anthropology?
Social science is a study of societies and interactions among the individuals within those societies, such as sociology, economics, political science, and history. Social science has been used to understand the social aspects and mechanism of disease and also other health outcomes, and also to develop various tools to address health problems such as medical geography, medical sociology, and health policy and health economics. That's actually what I'm doing in the past 20 years.
Dr. Smith Morris, what role has misinformation played in the pandemic, and what effect do you think it will have on healthcare delivery and trust going forward?
Although I appreciate the concern about misinformation, and of course, I, as a scientist, am involved and engaged in promoting good information available to the public, whether that's on the internet or in social conversation. I also think we have to pay attention to human adaptive responses. And humans will gossip and humans will talk about those exciting pieces of information. So going forward, I'd say we have to balance the evocative with the informational and the pragmatic. And to do that, we really have to understand human nature, and we have to understand some of those things that humans don't really want to admit to. Clearly, I think scientists have to spend some time on dispelling misinformation, or we've lost the battle.
Dr. Kim, will some of the behaviors that have evolved as regular routine things for us to do during the pandemic, like social distancing and wearing masks, endure after the pandemic?
Even if the scientists provide a scientific evidence of the benefit of mask wearing, people take those messages in a very different way given their social status, perceptions, even misinformation, as Dr. Smith Morris mentions. So according to my recent study, many Americans do not wear masks, also do not support for mask wearing mandates for various reasons, political, social, cultural, even based on their different knowledge or misperception. So given that we cannot avoid changing ourselves to these new trends of environments, we must try our best to make those changes good for me, my family, our community, and our society. So this is why we need more social science perspective and researches in response to this pandemic.
Dr. Smith Morris, we've all recognized that certain inequities have been made worse by the pandemic. What does that look like to you, and what do you think the longitudinal effects of that will be?
We're not so much still trying to figure out where health inequities arise, but instead we're looking more deeply into the mechanisms by which inequities get perpetuated accidentally or sometimes unknown or simply neglected. So we use that to help our teams go deep into secret, dangerous, maybe illegal or unpopular ideas. And that's what we draw out. That's really the niche that anthropologists fill for some of these teams that, of course, have to come up like Dr. Kim, with solutions at a global scale.
Dr. Kim, how do you think the pandemic has accelerated inequities, and what do you think a response to that will be going forward?
Globally, according to a recent study, the social protection spending on COVID-related measure in low-income countries was only $4 per capita compared to $850 in high-income countries. So this is also true at local level and also even household level. I expect to see some responses from the global community, also the local community, every nation to address this problem. But the task will be much more challenging than the pre-COVID period. So we definitely need to really sit down together to sort of come up with a solution, not only from one discipline, but more like multidisciplinary approach.
Dr. Smith-Morris, we all wonder what will be like when this is actually finally over. Do you think we'll see a wave of social connectedness or solidarity as we come together in more quote-unquote usual ways? Or do you anticipate that some of the mental health concerns that we've had throughout the pandemic could be accentuated or magnified after this is over?
Crisis demands that we question our values, we reconsider the things that are most important to us. And I think the notion of solidarity is essential in a public health crisis. We see people not actually responding to crisis by reaching out to others and practicing solidarity, but their bubble shrinks. Their circle of we, of whom they consider to be part of us, their group, shrinks down. So that's problematic. I think that's exacerbated or perhaps helps cause various other social and political debates that we're having, that shrinking sense of solidarity. It is typically a sense of security, or at least improved security, or a sense of resources and equity that allows people to grow those bubbles back out. We have to grapple with those dilemmas in a forthright way, in conversation with other seriously engaged people, and make some rational and overt decisions about it if we want to move out quickly, right? If we want to see the end of this thing more quickly. If we decide to be passive about it, then we'll probably get there, but much more slowly.
Dr. Smith-Morris, choices made during a pandemic often shape our world for years to come. What effect do you think COVID-19 will have on our world?
The struggles that we're having in terms of responding to infectious disease and the new global threats are informed by the new technologies and informational awareness that we have, because we enjoy so much privilege in this wealthy and powerful country. We're going to use that information to reach our best response.
Thank you both for being here today and for sharing your insights on the effects of the pandemic and what the world might look like as we move forward, as we recover from this unprecedented time.
Thank you so much, Dr. Warner. Pleasure to be here.
Thank you for the opportunity.
Thank you for joining us. Until next episode, stay safe and stay healthy.